All right, David. You want to provide your name or just your first name?
Yeah. My name is David Candela. I live in Reno, Nevada. I've been out here my whole life.
Great.
Yeah.
So we're going to go through the various harms of circumcision or preputial amputations to men, and you're one of them, as you've identified. And the first one that I cover is acropostion, and I explained to you earlier what that means. So were you cut? Was your just your acropostion removed, or were you fully preputially amputated?
Everything was removed. It wasn't just the part that exposes past the glands. No.
Okay.
Bare skin all the way down.
Oh,
Awful as that
man.
is.
Yeah, it sucks.
Mm-hmm.
I can identify there. So do you believe that that's sensitive skin?
Absolutely. Yeah.
Yeah.
It's a very sensitive skin, I'd imagine. From what I could read, it's pretty much the boat that I'm stuck in. I could just read about these things, and I can understand it from secondhand perspectives from intact men sharing their stories and whatnot.
Yeah.
And but I'm sure that's sensitive skin.
Yeah. So do you have much inner mucosa removed, or do you know if they were cut with a Mogen clamp or one of the Bell tools?
I'm not that familiar with the type of tools and what exact one. I mean, I remember reading somewhere where one tool creates like a dark brown ring.
Mm-hmm.
And I remember reading that one, and I'm like, well, that sounds about right, because it's the one that it like crushes down on it like 15,000 pounds.
So that's the Gomco clamp.
Gomco,
yeah. So that would be a Plastibell, or that would be a Bell method, because they put the bell on, and then they pull the skin up through around that bell, and then they pull that bell up, and it clamps off at the base.
Yeah, essentially just crushing it.
Yeah,
crushing instead of cutting.
Yeah. Right? And they
cut away the rest.
It makes sense. They crush it in order to make sure that the blood stops bleeding, and it has a chance to coagulate.
Yeah.
Okay. So your glands is not protected, and what do you think the effects are of having your glands out in the open all the time?
It just dries out. I mean, it literally is dried and even cracked to the point where it's kind of looks like what I would describe as like a dried raisin type thing. And those are things that I remember looking at it before I even understood the issues, and I'm just like, this doesn't make sense. I'm about 20, and why does it look like this? Because I've seen pornography and stuff, and men's penises do not always look like that, and it's just an element that I remember feeling subconscious about, not understanding what that was, is because it's supposed to be moisturized inner mucosal skin, really, the glands,
And that's why a lot of men, do restoration in order to try to pull that skin back up, to try to cover up their glands, or even seeing things, or even suggestions about like putting a rubber on and leaving it on all day long, because then things kind of just moisten back up again,
cover it up,
and reduce that dry cracking problem. Yeah.
So. I've heard people say, like, you can do an experiment where if you could successfully keep the glands covered throughout the week, that you will notice a difference, in the subtleness of the glands. It'll be, moisturized and stuff. And, I've actually done it before, and and I agree. It does. It moisturizes, and it kind of, in my way, in my mind, brings life back to the glands, and in a way that I've never known, because my entire life they were always exposed, and so therefore, how would I ever know that that's really how it's supposed to be? And you just try that experiment, cover up the glands.
Did you use a condom?
No, I just use this little fake foreskin type sleeve thing.
Oh yeah, I think I've seen those advertised.
Yeah, I actually use that mixed in conjunction with this product called I think Alpha Armor for men or something. It's by Intaction. It's supposed to be a lemollient type thing where you know, coat it along the glands and it'll help rejuvenate it. So I did that in conjunction with the foreskin sleeve, and within a week it was like, even though it didn't increase slack skin or anything like that, it did definitely bring life back to the glands. And for the first time I was able to feel sensations in my penis that I never felt before, you know, my entire life.
That's neat. I haven't tried that yet. I should go and give that a shot.
Yeah, I think people that aren't willing to go full force with foreskin restoration, because it is, you know, it's a very daunting thing when you really read about what it is and what it takes and all that stuff. And, you know, people don't see it as valuable, and like, well, you know, it's already a very painful issue for me as it is. I don't want to add to it. So, you know, doing that experiment, you could see what it's like to have that one element back, which is, you know, life back to your glands.
Yeah, I tried a condom, but trying to get it to stay in place. I mean, condoms aren't built for a flaccid penis. So I was kind of wondering how the Alpha Armor thing worked. You know, how, whether it was comfortable or anything like that to live with through the day after day after day.
It ended up becoming so comfortable that it became uncomfortable to not do it. And so I actually still continue to do it to this day. And and in my mind, it's definitely helps, you know, like I'd say it's an increased you know, sensation and overall enjoyment of sexual activity by about 30%.
Testimonial by David Candela. We gotta share that. Alrighty. So the next thing is the rolling mechanism. So it sounds like you don't have any rolling at all with the skin that you have on your penis.
Definitely not. No, the skin is just bare nub, you know, like, you know, I have the penoscrotal webbing, to where it actually pulls some of the scrotum skin up onto the shaft. And with that, that's just enough to accommodate the erection, right? But it still doesn't give you any kind of slack to mobile shaft skin or anything like that.
So you can't masturbate properly. you have to use lube, right?
What can happen is you actually pull the scrotum skin up forward so much to the point where the scrotum skin actually almost reaches all the way to the head.
Yeah.
And you know, that's something that I did as a you know, when I was first exploring my body as a very young preteen. And I didn't realize what I was doing in my mind. Like, looking back on it, I think that I could potentially have exacerbated penoscrotal webbing by what I was doing. You know, it was, and so in turn, I actually made it much worse than it could have been. But at the same time, because of those actions that I did, essentially pulling the scrotum skin that far forward, it made it to where I'd never dealt with the painful erections issue that some men have dealt with. And I think the penoscrotal webbing was a large part to do with that. You know, I've told people that in my mind, I think removing the foreskin, and in my mind, what caused you know, it ended up directly causing penoscrotal webbing. It's kind of like trading, you know, a good, valuable foreskin or prepus and all the different functions and natural features that it has for essentially completely useless, visually unsightly, what I call turkey neck, you know. And a lot of people have called it that because if you actually look at it from a side view, it literally is just like a flap of skin that'll go from the scrotum all the way to about mid shaft, and that's really far, you know. That's insane. And I don't you know, like I remember as a young teen thinking that those were birth defects, and the reality was, you know, that's ramifications from genital cutting.
You must have some excess scrotum then, because if I try to pull up my scrotum that far when I have an erection, I'd be squeezing my nuts.
Oh, exactly. Yeah. I mean, that's why I think that it was something that actually was causing as a young kid. Like, you know, I remember vaguely as a very young teenager when I first started getting erections and exploring my body, that it was very tight erections, and it was in a way uncomfortable, you know. But I think through time of masturbating and pulling that skin forward so often, I actually stretched it in the wrong direction, because had I known about foreskin restoration, I would have been stretching it in the right direction.
Yeah.
Where it needed to be, as opposed to down at the base where the serves no good purpose. Just,
Yeah. Bummer.
Yeah.
So the next item on the list is moisture lube. So I'm assuming you don't have moisture on your glands since you don't have any coverage on your glands.
Yeah, it's just from really young age is always just spit, and that's how it goes.
So KY Jolly or something like that, right?
KY jelly, yeah. The lube on the dresser jokes, right?
Yeah, exactly. It's
Mm-hmm.
I totally look at those jokes totally differently now than I did when I was a teenager. Yeah, back when I was a teenager, I thought it was something that every guy did, and every guy needed
I
lotion or
remember
whatever.
Eric Klopper making that joke about, like, since when did we evolve where we have to go down the street to a CVS and get some lube?
Exactly. Oh my gosh. Yes. Can you imagine? Oh, yeah.
It's ridiculous.
That's a great one.
Mm-hmm.
So you were just covering earlier that you do have the scrotal webbing. So I taking that means that you do get a hairy shaft during erections.
Yeah. When I was younger and that first started happening, and I was like, this can't be right. And I remember shaving that, I shaved it. I was like, okay, well, whatever. I'll just hide the problem, and that's it. And I just thought that it was just an unfortunate birth defect. I just got the short end of the stick there. But if you don't,
shaving your scrotum sucks.
I remember basically letting myself get erect and then shaving shaving just the hair that would get around the shaft itself, which meant by the time everything relaxed, there's this weird bald spot actual where scrotum skin would normally be, where hair on the scrotum would be,
Yeah, I other than getting snipped to avoid having more babies and getting shave, then I never shave. I just trim down there to make the hair shorter. So
I took a razor to it.
Really, that's just too scary for me.
Right down to the nubs. Well, I mean, if you think about it, what I was doing was I was trying to hide something. If there was ever a possible sexual encounter as a young teen, I did not want that to ever be the case where a girl's like, what is that?
Yeah.
Why do you got hair on your shaft? That makes no sense. So yeah, of course I was shaving it to the nub.
Hey, so it's kind of funny how you talk about how you wouldn't want women to look and see that you had a hairy shaft, and how so many women will use the excuse that they want their son to get blowjobs. And that's why they are going to get their son circumcised. Well, they might see a hairy shaft and decide not to give you a blowjob anyways.
It's a very very shameful thing. I mean, I don't see how anyone would ever in the right mind be like, oh yeah, see, this is just fine, like normal. I call it my bear dick or something,
Yeah.
It would take a lot of confidence to try to spin something that I think is a very abnormal feature about a body, And what I was thinking was a normal iteration, but really it was something that was caused by a genital cutting. I was like, I wasn't empowered with any of that knowledge really at the time.
So I've had troubles with my testes because of this. Have you had any issues with your testes?
No, not really. I mean, like what I was describing earlier. I mean, I guess you could imagine I got a fairly large scrotum sac as itself in order for it to do the whole pulling up 50% onto the shaft skin, that sort of thing. Like what you're describing about, like the testes kind of like pulling in, and then you have to actually let everything relax, and then like I've never even heard of that. Honest.
Yeah. Okay. I haven't heard of a lot of men with that problem.
Something about being older and like other older, so maybe that's something in my future.
No, it would be the other way around, because just like women's boobs drop as they get older, right? Our testes our scrotums get longer.
That makes sense. So that's probably why I never actually dealt with that issue, because
Yeah.
like I said earlier, my preteen years, I was like literally pulling that skin and literally creating a stretch and become essentially, longer than it would have been in a normal setting,
Kind of makes me think that maybe maybe it would be easier to try to do restoration when you're in your teens. more patience, more time,
The reality is that they say that, like the skin is all more supple and, ready to stretch, especially during puberty. I mean, your whole body's stretching.
Yeah.
It's stretching. And so your body is literally, that would be the prime time to do restoration.
Yeah.
Yeah. Of course. I mean, I don't know. It's not like there's much data on these things.
Yeah. So that's what I was saying is I don't have the testy problem anymore because my scrotum has stretched out as I've aged. So it was mostly a problem in my teens and 20s. It steadily went away into my 30s. So, pelvic floor. Do you feel that you have a pelvic floor issue?
Not that I say. I mean,
Okay.
It's like shifting to upwards, right?
Yeah, so you got your body here, right, and your penis, is coming out here, and if you don't have skin, you got the skin going here to your stomach, or the base of your stomach area. When the penis goes out erect, when the corpus callosum is filling up and you're getting an erection, well, if you don't have skin there, then it's going to pull it up like that, kind of like a crane works, right? So that's a problem that I still have.
Is it?
Oh yeah.
I remember a friend having an issue like that where literally it was just apparently so upwards that it literally was like right there at the chest. To the point where,
It's like for me, it's like it will get tight up against my chest or up against my stomach. It's like I can make it touch my belly button.
Yeah, I mean, I remember hearing that issue before with someone expressing that. It was literally like you could pull it and it'll just snap right back.
Yeah. That's how I figured it out myself. Is I heard someone else complain about that, and I was like, yeah, I had that problem too. So it's why we had to talk about it, so other guys realize, oh, that's an effect of circumcision. Oh, that's also a circumcision side effect. I didn't know about that. Never thought about that. So
I think it has ramifications because it's kind of like, instead of it being a side effect, it's like these things are kind of expected in a way. Like you're expected to have a whole list of damages. You might not have them all, but you're gonna have a bunch of damage. And so it's like, instead of it being side effects, or it's like, oh, this may or may not happen, it's like this will happen. You will have keratinization of the glands. You will have, these various issues.
Yeah, and there's some men that I've talked to that say they've been circumcised, but they still have a lot of glands coverage. So I asked them about what their CI is, stuff like that, and it's like, okay, well, you got circumcised maybe the old-fashioned way, or I've even heard of circumcisions that only involve like a prick, to get a little blood out in order to make it kosher for the Judaism or whatever.
And in modern times, you can't even call it a circumcision, right? And if you call it a religious one, sure, it's like, oh, it's a little prick, and it's like, if it was FGM we're talking about, that's absolutely a genital mutilation. You can't even prick the skin if you wanted to.
Well, that's just like there's several types of FGM. There's actually multiple types of MGM. It's just that so many of us have been cut the way that we get cut here, particularly in the U.S., where they use the Bell methods or whatever, and they try to fully remove all coverage of the glands. So some like I got into a conversation online with this other guy who said, well, if they do it right, then you still have glands coverage. Like, well, define right. We'll draw the lines. Where are you going to draw the lines at? There's no law saying where the lines are. No regulation.
Doctor will feel like it needs to be down to the nub, and another doctor will be like, you want a little bit, so that we have something that has room to grow. It's like there is no line. It's arbitrary. It's absolutely arbitrary. These people are just choosing what they believe is right, and that's why I call it a man-made penis.
Yeah,
like
exactly. I mean, at least let the guy grow up and then draw his own dotted lines where he wants to have it, if he really wants to, which is rare.
I, like, why would you ever want to really alter the genitals? Like people that get genital piercings is a very low percentage of the population. It's incredible, and I think if circumcision was to be looked at rationally, it'd be really low. It'd be like 2% of the population that even
unless it was horribly damaged in one way or another, like it got caught in a zipper door jam or whatever. I don't know what could possibly happen. I mean, just like any other body part, something could happen that could disfigure your body part. You might just want to much rather just get it cut off or whatever. But
I've jammed my finger in the door, but it wasn't and as bad as it was cut and smashed and turning black on me. Like, it was never a thought like, hey, let's cut this off. Like, no, let's just heal it up, bandage it up, and let's and it healed, and it's okay. It's fine. I'm fine. I didn't lose my fucking tip of my finger.
Yeah. I've been dealing with one toenail that's been giving me a heck, and I could see possibly saying, well, let's just get rid of the whole darn toenail. I don't need it. It's really not important to me. I don't know. I gotta leave that up to each individual to decide for themselves as a well-informed adult.
Like, is there much value in keeping that big toenail or whatever toenail it is? There's really not all that much value. It's aesthetics. It may look a little funny if you don't have that toenail there. But
at my age, I don't care.
It's not going to inhibit your ability to walk. It's not literally be a disability, because that's what genital cutting really is. It's a disability. It's an imposed disability on the penis. That's a sex organ, and right out the gates, mutilated.
Definitely. Yeah, that's the purpose behind it. So did you have meatal stenosis?
Yeah, definitely. I would say that's a meatal stenosis issue where it's narrow stream. It doesn't really, it like blockage and all that stuff. I've never seen a doctor about it, but it's something I'm sure that's a ramification that I have. I've had friends who circumcised and not circumcised, where they when they urinate, they didn't have it didn't take as long, like the clear blockage, like if you close, right, and you put your finger on it, and you're like you're blocking it and you're making it all high pressure, but at the same time, so it causes like this pain and this blockage and this backup filling. And it could get painful, but it's manageable. I don't think it's one of those things where hopefully it won't get any worse. And
I mean, that could cause kidney damage if you can't relieve yourself.
I've thought about that, but and I hope it doesn't get worse with time. I don't know if it will. I mean, someone like Jimmy Kimmel, he probably had meatal stenosis from the very moment it happened, and it probably just progressively got worse with his age, and he eventually did have to have surgery on it. And that's a very person, and he probably doesn't even fully understand the correlation between him being mutilated and that happening, because it's not like urologists. It's going to be very honest in that, and it's just going to be like, these things happen.
Yeah, exactly. When we know that it's an effect of not having coverage of your glands.
And you would think of all people who understand these things is urologists. Like they deal with so often that you would think.
Well, you would think, but I've read a sizable urology book recently, and I found so much bias in it. It was really sickening. And I wrote a nice thick paper with screenshots from the book and everything, and sent it to, I think it was eight MDs involved in editing the most recent 2020 version of that urology book, and gave them feedback. So
it's really good.
Yeah.
I'm glad to write such a you know essay on it, essentially.
Yeah, I'd like to get through more urology books, but gosh, there's just so much to do in this movement. I could probably hire 5 people and keep them constantly busy doing things, if not more.
Very multifaceted. It's,
Yeah, there's so many ways, so many things to do with this movement. It's erectile dysfunction, is that something that has affected you yet?
yeah, I mean, I'd say in my young years, the thought that I was born, I had these different elements about my penis that I thought were birth defects, and ended up like discovering they were ramifications from circumcision, and because of all that, I guess being self-conscious about it, definitely psychological impotence and erectile dysfunction.
Yeah.
I ended up having a few sexual encounters in my young years that they were just so awful that it made me just deter myself from the idea at all. And so I separated myself from any kind of idea of having relationships, and just put myself in work, and was going to put my focus on work, and that's what I did for many years.
Yeah, that's what part. That was one of the purposes of doing this in the first place, was making good slaves, right?
Oh, yeah.
In Egypt and even in the U.S., they did this to black slaves in order to keep them from raping, the white women, and make them into better slaves.
You make people docile, because there's stories of it going all the way to ancient Egypt and them doing it to the Egyptian slaves, and they did it for the same reasons, essentially, to mark, humiliate, and basically keep their eyes on the work at hand. Like there's no worldly pleasure in this life for you, because you're a slave and you're to work day in and day out. And it's like, I mean, if you really think about it, it's a really awful thing to do to people, and they probably were mutilating them as men to really let them understand how little you are to them. And it was in Egyptian days when they were mutilating them. They probably didn't mutilate them as babies. And I'm sure that came about later on with Judaism, and I've heard it speculated that that would happen with the very beginning of Judaism. Was they were like, hey, because we're already being subjugated to this treatment, we should just embrace it, and in turn, circumcise our children before our slave masters have a chance to do it to them, because maybe in their mind they were rationalizing it as a more humane thing to do to them.
That's an interesting theory on that. I didn't even put that together before. Some of this Rosemary Romberg got into in her book, some of the history and the theories and everything about how it escalated and all that. So yeah, interesting. So you started learning about what was done to you when you were pretty young. Very much different from me, where I learned when I was 35 and kind of learned from there.
For me, I learned that I was circumcised as young as 12 years old in a 6th grade sex ed class.
Yeah.
And just real simple. The teacher wasn't spending much time on it. It was just kind of like, all right, this is the sex ed anatomy portion, and they showed a brief image on the screen, little old school overhead projector of a circumcised and an uncircumcised penis. And I remember the lady, she was a female speaker. She said some parents opt to have their children circumcised, and some aren't. And she said that either way, that they're no different. But I remember still looking at that image and just being so shocked. I'm like, you mean that's what a penis is supposed to look like, and then this is what my penis looks like because of an arbitrary choice that my parents made? And at the time, I was just so blown away. I was so shocked. I was so confused, because ultimately the way my parents raised me in a very religious
mindset, which is one of the things they always really tried to drill in my head, which is like, your body's your temple. You're supposed to respect it, sanctify it, and not do like drinking, doing drugs, and even tattoos and piercings were taboo in their mind.
Really?
And those were things that they brought me up on.
But cut off part of your dick.
Yeah, and it completely contradicted that, you know. And it was, I grew up knowing that my tonsils were removed at about 3 years old, right? I was told that I was sick. They brought me to the doctor. They determined I had tonsillitis. They then removed my tonsils. So then, you know, and that was a story that I remember being told as a young kid all the way, you know. So I'm like, okay. So that happened because I was sick, right?
Yeah.
What was it that warranted this? It made no sense at all. The teacher didn't make any distinction, because she just said some parents elect to do it, some don't. Yeah. It was very, you know, and she was obviously trying to not be very biased, in the sense that my state, Nevada, is the lowest circumcision rates. They stopped Medicaid's circumcision as early as '89, I believe.
Yeah.
So the odds were, and they probably were aware of it, that the majority of the class was not circumcised. And sure enough, at the end of the class, everyone, you know, boys talk. We all talked. And sure enough, I found out it was only me and about 4 other kids in my class, you know, like 15 kids, all males. And it was just me and 4 other kids, circumcised ones. And none of the other ones were, you know. And I remember just being so upset. I didn't really want to talk about it, but I ended up talking to my mother about it, who I felt a little more comfortable with bringing that up. Mm-hmm. And her immediate response, Bible, you know, the Bible told me to do it. The Bible says to do it. And she started on this whole tangent about how men who aren't circumcised are sexually promiscuous, and God wanted to, you know, control their sexuality and keep their focus on their God and on their future wives.
All right. Was there anything else you wanted to add about that?
No, I mean, other than they just put that idea in my mind where, you know, God's the one that ordained this. And so it, in a way, really put a wedge between me and even having any kind of relationship with religion. Because right from that moment, I kind of despise this idea of God. Because I'm like, how can you tell me that this is what God wants? You know, I was told my whole life that he's a good being, and suddenly, bam, he wanted the tip of your dick removed because he thought that you would be a promiscuous person. Basically, like, males are something that has to be contained and controlled, while girls are supposed to be protected and upheld, you know.
You make me think maybe I should add another harm to this, because it does tend to chase a lot of people away from religion, because of the fact that it's religion that that perpetuates or created, at least it appears that it's been created by, but definitely perpetuates genital cutting practices. So, yeah,
you know, like, young age, I had this huge, you know, kind of just like, it felt like it burned a bridge between me and whoever this God character could have been.
Yeah.
You know?
Yeah.
And,
so,
yeah.
As a parent, that might be even more reason not to cut your child, because you want your child to love God, or, you know, love, you know, whatever religion that you believe in. Don't cut your child.
It's essentially completely impossible to love the idea of a God that literally commands the mutilation of the most defenseless humans in the world imaginable, infants. You know, like, it's sick, it's disgusting, and it all this more illustrates that it is a creation of man. You know, if there is a God, it is definitely not in those texts, because because no God would name that. You know, like, it's completely contradictory. You know, and in a way, you know, like, robbed that aspect of me ever having a relationship with a God figure. But that's fine. You know, I personally am not too torn up about that. I'm more torn up about this idea that people are just so insistent that it's some sort of religious right to mutilate a child, when a child has a right to their whole body.
And the right to choose their own religion.
Exactly. We don't own children. You know, like, you know, back in the day, it might have been a mindset where the child is born and that is a property of said family, but really we're not in that mindset anymore, and we're not in that time frame anymore. And we can actually look at humans for what they are. They're human beings, and they deserve to be protected and respected in the rights that they have inherently.
Yeah. So my belief is that unless totally medically necessary, all circumcisions are botches. But there are definitely cases where men have been like horribly botched. I mean, all the way to the point of, babies dying, right? But there's lots of cases where, botches cause curved penises or skin bridges or other things. Do you feel that you've had any of those?
I think just removing the prepuce itself is absolutely a mutilation. I think the term botched itself is kind of like warranting it as a medical procedure, and I don't think that you could really warrant it as a medical procedure for children. Like you mentioned about medically pressing things, and like as an adult you could have some sort of serious injury to your penis where like the prepuce has to be removed, in order for you to have anything left, essentially. And like, so, there's instances like that, but the intactivist movement has always been like every circumcision is botched. And it's like, I think of it more as like every circumcision is a mutilation, because by calling it a botch is putting it up there as a medical procedure, and it's not.
It's not. Yeah. At most, it's a plastic surgery.
But as far as like the general ramifications, like medial stenosis is a ramification directly a result of genital cutting. Penoscrotal webbing, that's another. Keratinization of the glands, that's another one. And those are the three main ones that I know without a doubt affect me. And that's aside of thinking about all the other losses, such as mobile prepuce skin, that aids in intercourse, that sort of thing. Those three main ramifications, which you could, I guess, call botches. Sure.
Okay. The another section of the video I'm putting together is about how this affects relationships. Partners, sexual partnerships, whether it be heterosexual, anal, or homosexual activities.
That goes all the way back again to when I was a young teen, like exploring my body and wanting to explore sexuality with others, and like the fear of rejection from women or girls, at the time, my age and stuff. And so, there's instances where I was rejected, and it was a very painful thing, and I couldn't help, like, she wouldn't have done this if it wasn't for this, right? And in turn, again, thinking I was born deformed, a really naive thought. And looking back on it, it was just me trying to create rationalizations in my head, because I wasn't ever equipped with the knowledge that I was actually harmed by surgery. Like even when at 12, once I learned what circumcision was and I saw the two pictures, that lady still lied and said that there was no difference either way. And so I took that to heart. I believe that there was no difference either way. Contrary to the fact that, my mother told me that it was meant to intentionally stifle sexuality, and, with that logic, it's like, I must have been mutilated with that purpose, like I'm not supposed to be a sexual being, and so it was just really confusing. And after being rejected by her, it just hurt really bad. I didn't know what else to do. I actually hooked up with a friend of mine who was a guy, and I kind of learned real quick off the bat that he didn't care at all about my penis, right? So therefore, in my mind, it was like a win-win. I was able to be intimate with somebody. I was able to be close to somebody, and I didn't have to feel anxiety about my body in that way. I was able to be loved and appreciated for my body without that element coming into play. And so it was really difficult for me because, you know, I sat there and I rationalized in my head, like, this is what I really want. This will work. I could do this the rest of my life. Right. And I tried. I tried to, you know, I made relationships with men, you know, growing up, and it ended up not working out in the way that I ever pictured, which was, you know, what I truly wanted in life was actual, you know, I don't mean to sound like heteronormative, because a lot of times when I talk about this side of my life and my story, people will think that I'm trying to put down the entire idea of people and being with other men.
Mm-hmm.
But the reality is this was just my experience. You know, I was raised with, you know, when that religious element came, the religious elements came into play when it came to circumcision. It drove that wedge in between me and God, and I wanted to rebel. You know, my mother for telling me that men are just have to be sexually stifled, you know, and then that experience with that girl, and she was just so appalled and off put by what she saw when she saw me. And, you know, I was only 13 at the time, and I know I was really young, and it's really typical for boys to be self-conscious in general. But I remember she looked at it and she was like, "What happened to it?" You know? And I remember at the time I didn't connect what she was probably talking about. But like I mentioned earlier, with the circumcisions rates being so low in this state, she probably had sexual encounters, and she probably was with other guys, and they were probably all not circumcised. And in her mind, that was just normal. She didn't think anything about it. And so she was probably shocked to see that.
Yeah.
And she couldn't help herself, but she instilled that idea she instilled it even more, the self-conscious.
Yeah. So it can go either way with women or girls, women. Depending on how they're culturally conditioned and what they're used to. I mean, seeing the opposite is like seeing an alien. You know, it's shocking, right? So in cultures where they don't cut, if they see a cut man, then they're freaked out and they might reject you, and vice versa might happen as well. You know, I see all the time women saying, "Oh, that's gross" or whatever, to see, you know, an anteater, elephant, a worm, or whatever. So it would be nice if intact, normal, natural was normal all over the world.
Yeah, I think the sexual preferences come from, you know, essentially your first sexual encounters. You know, like when you're first exploring with a lot of these times, you know, like your preferences will be based on those interactions at those young ages. You know, like I don't know if there's much scientific backing on that, but you hear it all the time. People's preferences often stem from early experiences. You know, like whether your first date was someone with a brunette or something, you know, and then you end up growing your whole life and you're really into brunettes.
Yeah.
You know?
Yeah, that's true. It's possible. So is there anything else you wanted to address specific to your sexual partners?
No, other than, you know, you know, once I finally found it within myself to just, you know, screw the self-consciousness, I'm just going to go for what I want.
Good.
You know, I bucked up, and I made it a mission to essentially just, I'm going to find someone that will be patient with me, you know, and deal with my lack of sexuality, actually, you know, because with the damages that have been done to me, it's really hard for me to actually do penetrative sex and actually feel anything, really, you know, because the amount of damage to my penis is like, there's nothing, there's almost no feeling. It's like, you know, and it's, I'd have to lie to people, be like, yeah, I feel it. Yeah, it feels great.
Yeah.
But, you know, and anyway, I went for what I really wanted, and I went for it full force. I eventually found, you know, people that were, you know, in a way sympathetic or listening, or, you know, and I eventually met my wife, and everything really worked out, you know. So and I think that there's the right person out there for everyone. You really have to wait and be patient, you know. And in turn, she happens to be a woman who's been with intact partners, and so she actually does know the differences. And even though she you know, has her own preferences, she knows, you know, she's patient, and you know, she tells me she wouldn't have it any other way, and I you know, it's really nice of her. But reality is she and what parents did to me too, you know, and I think she's the one who gets the earful of it all the time, every day.
Yeah.
You know, and she's the closest one to me, so she'll get to hear all that. But you know, when it comes to relationships, there's a lot of what could have been in my life. You know, like had I not gone down that road, had I not been so self-conscious, you know, like I might not have wasted all those guys' time. Because while all those guys were nice men that wanted to be in legitimate relationships, you know, they felt gay. You know, I remember being in those relationships with them and being very honest with them and being like, look, I am only doing this because this is the only thing that I can do. And I remember my feelings of resentment with circumcision, and they would all just dismiss me and say, "Oh, that's crazy nonsense. You're crazy."
Well, we're gonna compile a thing here, and hopefully that'll address the people that think we're crazy. If you know, if people hear enough of us complain, maybe they'll stop thinking that we're crazy.
Yeah.
So psychological, yeah, there's definitely a lot of views on psychological impacts as far as how the person is psychologically impacted from birth when they're cut on. But it sounds like you were also psychologically traumatized when you were 12, and you learned about the differences. Well, you learned a little bit about it from sex ed in school, and you learned more about the reasons for it from your mother. Are there any other psychological impacts you feel that you've endured?
Just, you know, when I was whenever I expressed it to people, friends, family, you know, like it was, I feel like it was very psychologically draining to be constantly dismissed and belittled. And because I at the time was not equipped with any kind of knowledge on it, really, it was just me purely expressing my feelings on the matter, you know. It made it much easier for them to just dismiss what I had to say, you know. And I remember it being compared to FGM a lot, you know, like people would be like, oh, how dare you try to compare it to that? Those girls are being consent. And I'm like, well, what? Don't you realize I didn't consent to this? And they're like, oh, but you would have wanted it. It's like, what? That is so disgustingly arrogant.
Yeah. And I know that getting dismissed keeps a lot of men from talking about this. I kind of have this mentality where when someone challenges me, I just get stronger and louder and tougher and meaner. And so, you know, you dismiss me, you're just asking for more is what you're doing. I'm going to be even louder about it. So
That's awesome, man. That's a good trait to have. You know, like for me, it's kind of hard to not get kind of triggered, I guess, in a way, for lack of better terms. It's like when someone's like, literally, I'm just gonna look right in your face and dismiss you and tell you that you're wrong, and you know, it's hard to actually not get upset by that as a victim, you know. And it's like that's why sometimes I see women activists as being really effective, because they could be subjective and talk about these issues without it ever triggering them. Well, you know,
well, depending on where they're at. I mean, like, you know, if you look at Hebo or Deer, who's in the UK, she's, you know, pretty much everyone there agrees that female circumcision, or whatever you want to call it, is absolutely horrible. And when you're like guys like you and I that are living in the US, where it's been so normalized, it's a lot more challenging to speak out. And that's why at the same time you won't see these women and, you know, speaking out in Africa, for example, very much. They have to run to these safe houses or whatever to avoid getting cut. So it's pretty sad in those situations, and we're kind of somewhat in that situation. Luckily, we in the U.S. we're lucky enough to have freedom of speech and all that, where we can at least stand on sidewalks and hold signs or whatever. But it would be nice if people would at least listen to us. I mean, doctors and lawmakers and stuff like that. Even our social media platforms are banning us or deleting our posts and stuff like that when we try to speak out, which is really sad. But at least we have some room to speak, and we don't have to worry about getting our heads chopped off for speaking out against a religious practice.
Yeah. I mean, when you think about countries like the nations of Africa that have genital cutting of both sexes, it's a very prospect, because they literally, some cultures, the governments even allow it, where you're allowed to go into these people's homes, pull them out into the middle of the streets and mutilate them in front of everyone.
Yeah.
And that's completely fine. The government apparently encourages it. When it comes to male genital mutilation, like at one point they might have done the same thing to females, but now almost none of these countries even allow it. But culturally they're still in on it, like the women from Nigeria, they're so in on it. They sound like circumcised men, where they're like, oh, I'm circumcised and I'm fine.
Yeah.
And it's a cultural thing. So even though the governments out there have put their foot downs on FGM, and they won't allow it to be done to children, women will still voluntarily go and get themselves mutilated and not stuff like that. And the government really can't do anything about that. Autonomy, right?
Yeah, there's a whole playlist on YouTube. I think the person that created it is called Clitoria Nipples, but you look at those videos and you do see variations of of little girls getting cut all the way up to adult women choosing to get cut. So yeah,
crazy. It's like people could sit there and take those nations and what they're doing and be like, see, there's nothing wrong with what we're doing over here. I don't understand correlations, because I think it's just the general sexist cultural biases that it's a worldwide phenomenon, really, to kind of think of men as tough. They'll tough it out, and you somehow project that onto little boys and be like, oh, he's a man now, like a lot of weird. It's just culturally ingrained sexist talk when it comes to men, and there's a lot of culturally ingrained sexist talk when it came to women for a long time, but we've been addressing it for a long time, and we hey, that's not appropriate. Don't talk like that. Like, come on now, like, but it's somehow still culturally permissible to talk like that about men and boys.
Yeah, it's yeah. If you made the same jokes about male circumcision, but make it about girls, you get hung.
Yeah.
Yeah, be hanging by a tree in no time. So the next section of the show is about relationships. Start off with child-parent trust. Do you feel that that this has affected your trust of your own parents?
Yeah, I mean, it's hard for me to look at them the same, to think like they just gave this no thought, and the only thought that they really gave was this really strange biblical context, which, until I actually started looking into it, I never heard of anyone make those claims. Like, I remember when she told me that about, they circumcise people because they're promiscuous. Like, I remember at 12 years old being like, I'm going to read the Bible myself. I'm going to figure this out myself. And sure enough, I never found anything in there that explicitly illustrated what their perspective was, other than some talk about, there's parts in the Bible that just, it talks bad about uncircumcised men, like as if those are the Palestinians, like, but really that wasn't so much talking about them like they're bad because they're uncircumcised. They were bad because they were not godly, you know? And so really there's no talk about, let's do this to them to make them less promiscuous, or let's do this to them to keep their eyes on God. It was like, there's talk of a covenant, there's talk of all this other crap, but there was none of that. So it made no sense. And so definitely drew a huge wedge between me and ever looking at them the same. And and I think it made it worse as I got older when I did discover the truth around all this, the full truth. And I was very upset about it. And I remember calmly when I visited my mother and my sister would be there, and I remember telling her, like, it was my wife. She actually told her, she was like, "Oh, we're not gonna circumcise our son, when he's here, and then I remember like chiming in and like, yeah, it's like I don't want, I'm like I remember saying how mad I was or something, and then I told my mom, and then like it turned into this whole thing, right? But then just like a week later, she comes to visit, and then my mother brings it up again. Oh, it was my sister. She was like, "Oh, mom really wants you to know that if money is an issue, that she'll pay for it."
Oh,
And I was just like, "What?"
still stuck
Like, did
to it.
you not hear that conversation? Like, did you not feel the tensity of that conversation? Like, do you not understand how hurt I am by this? Like it was never about the money. Like, you think money is the issue? Like, I could have, I had enough money to pay for it 10 times over.
Yeah.
That was not the fucking issue. If money could just fix everything in the fucking world, I would have got everything fixed myself. $10,000, whatever it costs, like I would have did it, But yet she was just so quick to be like, yeah, if it's money's the issue, in a way completely dismissing the fact that I even had a conversation with them the prior week. And that was me trying to just bluntly tell them how unhappy I was about this, but at the same time being like, I don't want to talk about this because I am very hurt by this. And, I can't believe you. And, she was just like, I thought it was about the money.
Yeah. Oh man, that's sad. So you're a dad of a boy, right?
Yeah.
Yeah. So was there any challenges discussing this with your partner?
Just at first, she thought that was something that we should do. She grew up with her brother. He was never circumcised. He's about 10, maybe 5, 10 years younger than her.
Mm-hmm.
And so she was like a little 8-year-old girl, and her brother wasn't circumcised. And she apparently at that age onwards was hearing nothing but her mother complain about how the doctor was such a piece of shit because he didn't circumcise her son like she asked him to. And it's funny because when I hear the full story, it sounds like the doctor clearly was not, he was against circumcision. That's what it sounds like because the man told her that he won't do it right now, that you'll have to come back for a consultation, and this consultation will cost this much money, right? And then once you do that consultation, you'll have to come back for another, and it was like giving her the runaround. And then when I heard that story, I'm like, that sounds like that doctor just really did not want to do it.
Yeah. Wow.
And
interesting.
And so, but in turn, she just kept, basically blaming the doctor the whole time. Like, oh, he's such an asshole. He should have, did what I told him to do. And, and she would talk to the ladies at church, and then the ladies at church would be like, oh, your son's not circumcised. Like, what's wrong with you? Like,
mm-hmm. So he probably didn't cut off too much, and he's probably still had coverage. And
well, they never circumcised.
Oh, they never. Oh, okay.
Like,
okay.
What I'm saying is they wanted him circumcised.
I got it. I was hearing it as he wasn't circumcised the way that she wanted him to circumcise, not that he didn't circumcise at all.
At all. Like, and and I think the doctor just clearly didn't want to do it.
Yeah.
Didn't want to tell her that, because I think if he would have sent her to someone else, that it would have just been done. So I think in his own way, by giving her that runaround like that, it was his own way of basically, potentially.
That boy needs to go thank that doctor.
Yeah, he's retired and dead now, but he was an older man, and he apparently was, giving them a runaround and didn't want to do it. That's what it sounds like for me, anyway. But anyway, yeah, my wife just grew up hearing the very negative connotations around it, which was all unfounded, because even later on when I asked her mother, like, where was all this negative connotations coming from? Like, why do you feel so insistent that your son should have been circumcised? And why do you regret so much that he didn't? Because she lived living her entire life, like regretting this huge fundamental thing, like she failed her son. Like she literally was believing that, and so it was a very, I guess, intimate moment I had with my mother-in-law when I was able to actually sit down with her and talk to her and be like you actually, you didn't know it at the time, but you did the best thing for your son, and and it wasn't her call because if she her way, it wouldn't have gone that way. But those circumstances and how everything happened was the best possible thing for him, and she's totally on board now. And if she's ever given the chance, she said she wants to join us in the protests and stuff like that. She did a complete turnaround because in a way I set her free from that guilt. She was literally feeling guilt for a really long time, and that's why she was trying to instill that into my wife, saying, oh, you better get your son circumcised so you don't have to feel the way I felt all these years, when really there's nothing wrong with her son. Her son's fine,
Yeah. So it sounds like it wasn't too much of a battle with your partner then. No.
It was real simple. I mean, it was that time when she her mother-in-law was her and her mother were talking on the phone, and I was and she said that, right? I overheard it and I was like, oh hell no, that's not going to happen. And I in a way got triggered because even though I didn't have all the knowledge to know how horrible it really was, I remember the feelings like I'm never going to do that to my son. Oh hell no, like I would have preferred this not ever happen to me. So I'm going to of course protect my son. So I remember telling her, hell no, and then she was like, oh, of course we're going to do it because of this and this and this. She listed off all these, bogus things. And I remember telling her it's not medically beneficial at all. Like I didn't, I wasn't equipped with the knowledge as to why it's not medically beneficial. But I've had tons of friends that were not circumcised that they had no issues at all. Like there is no like, oh, this is somehow a bad thing. Like, and so that was the night where I was like, you know what, I'm gonna find information online to show you why it's not medically necessary. And that's basically where it started. And then I found way more than I bargained for, because I was just looking for, why I shouldn't do it to my son, but then I ended up discovering all these things about myself. And so it became a really intimate self-discovery journey. And so the next morning when I'm all, I'm all up late at night looking at the fucking computer and she's like, bed yet, and I'm just like, it's like, I don't even know how to, put this into words, all these things I'm learning, and she, at first her knee-jerk reaction was, oh, you can find anything to support whatever it is that you believe. So it was like, that's the end of that, and she was just so certain that I was just trying to basically instill what I wanted on my son. And I'm like, oh, isn't that kind of like what everyone's ultimately doing? But at least what I'm coming from is very profound. Like I've actually done research. I'm not just psychologically like, like the people who just really want to circumcise their sons and have no real reasoning why. And they don't, like if you ask them why is this so important to you?
Right.
Ultimately, they don't have any real reasons. They'll say, bogus shit like it's cleaner or it'll do this or it'll do that. And all those things would be easily debunked. So the reality is they want it because they don't really want to look at their own suffering and their own.
Yeah. I mean, you're basically in the opposite chair from most men that we deal with, who are cut and they want to have their sons cut because, look like daddy or whatever, right? So
that's crazy. I mean, I remember the doctor, when we were telling her how we're not going to do that, she actually had the nerve like, oh, you want him to look like daddy, huh? And I just got so mad at that because I was like, how dare you even make such a fucking comparison?
Yeah.
Like, so incredibly insulting. And I was just like, and I remember telling her, I was like, no, ma'am, I was mutilated, like I don't have my whole dick because of some random, I and it's like, I try not to get upset because like the whole, when he was being born and dealing with doctors, it was during that time when I was learning about all these things and really, and also at the same time, like dealing with my own pain emotionally from discovering all this stuff. So it was hard to not just go into a moment of a fit of rage in a way and literally want to cuss these people out. But I wanted the birth of my son to be a very, as beautiful and a great moment, and not have to be surrounded by that mess, And unfortunately, they were very insistent about soliciting it and pushing it over and over and over. And I
Man.
do what my father never did, which was tell them fuck off and no,
Yeah.
And in a way, it was very surreal because I was in the position where my father once was, and I was able to do what he didn't do, which was protect me, protect the child, and stand up, and not be like, I'm just gonna socially conform and force this onto my child so that way he too will socially conform as to what we believe society should be, and it's really, really sick, like I remember when I first brought it up to my dad as an adult, he compared it to you don't want to be the only person on in a neighborhood with unkept grass, like,
That's a bad comparison.
it was terrible. 'Cause I'm like, how dare you? Like, that is so messed up. Like you're sitting there comparing my suffering to cut grass. Like a neighborhood is a very pristine HOA neighborhood, all cut grass only and half an inch or an inch high or something, and then when you're a guy who has 3-inch unkept grass, you would be ostracized, and society will look down on you, and no one would want nothing to do with you,
Yeah. So that gets to my last one with the relationships, was the doctor-patient relationship. Do you find yourself not trusting doctors in general, and even nurses in general, not even for stuff that's not, even for stuff that's not related?
Yeah, it's definitely hard to trust doctors. I mean, from a young age, I tried to avoid doctors every chance I got. I remember, if whenever I got a cold or something, like most kids would capitalize on being sick and be like, I could stay home, right?
Yeah.
Me, I was like, being sick equals a trip to the doctor, and so I would try to hide it, and I would do everything I could to hide that I was sick, and it was like almost the exact opposite of what normal kids would do, because I did not want to go to a doctor, and literally kicking and fighting the nurses, when it came to shots and stuff like that, and I remember fighting so fervently. I remember it was 4 nurses. My dad was even like so amazed, and he would tell the story later on. I was only 4 years old, but it took 4 nurses to hold me down to
Yeah.
do that.
Yeah. But so for me, it's like, well, if doctors and nurses can push something that is clearly harmful, at least it's clear to me. I mean, the Sorrells study has been out for well over a decade now. Why don't all doctors and nurses know that circumcision is harmful? How can they push something that is harmful and break their oath? If they could do that in that part of their job, how many other things can they be breaking their oath on?
Yeah, and at times not even thinking about it because they're just going with the flow, and they're just going with the textbook things and what they learned in medical school, and if science could come out like the ointment when a baby's born, they put ointment in the eyes. If the science was to come out saying, hey, this actually isn't beneficial for them, this is actually causing harm, and you shouldn't do it, right? That's what the study would come out. Ultimately, majority of doctors would continue to do it for decades to come.
Yeah, that's sad.
How it is,
As a billable thing.
Yeah, like they'll just continue to do it,
Yeah.
and because the information hasn't got to them, and it also may be because, like you said, this is a for-profit system where it's like you could bill anything to make money off of it, and so whether it's putting ointment in a child's eyes or mutilating their penis, it's a billable fee that makes them money, whether it's charging the insurance companies or it's charging you.
Yeah. Yeah.
And as an adult, I stay away from doctors' offices. I mean, I don't like visiting doctors' offices. The only times I ever visited is on behalf of my son. But for myself, I haven't really seen a doctor in years.
Yeah. I tried talking to my current PCP. He actually grew up in Egypt, so I actually brought up the topic, but he just totally avoided it. So, I was really hoping to talk to him and try to understand what his thoughts were on it all, but they just seem to want to avoid it for whatever reasons.
Probably the same thing. He closes up. It's a touchy subject. He doesn't want to talk about it himself. Like I remember with my son and his pediatrician before we he was out of nowhere, he brought up like, oh, is he not circumcised? And he was like talking about how circumcision's better. And I was just like, I was like, how? And I literally got on a full-on debate with the man, and every single thing that he said, all he did was walk himself into a contradiction every single time. And I remember right after it happened, I remember to write it all down so that way I could have the best memory of how it all happened. But I remember him saying things like, that's strange. You guys aren't Mexican or Hispanic. Like, only the Mexicans and Hispanics don't circumcise. And I'm just, that is like really like a prejudice statement. Number one, and secondly, like majority of the world doesn't circumcise.
Yeah, no kidding.
There's millions of Europeans, millions of Australians.
Yeah.
South America, Africa,
Russia, India, China.
There's even African countries that don't circumcise.
Yeah,
like they actually have. Huh?
Yeah.
Crazy, right?
Yeah. Okay.
He was.
So the last thing I have on the list is social productivity. Now, I'm not sure about this one because in some ways, like you were saying before, being that you're cut, you've avoided having sexual relationships and thus kind of buried yourself in work, which would in a way make you a great slave, make you make you a hard worker, get you're socially productivity, you're socially productive. However, I see myself personally as I would much rather be spending my time feeding the homeless or building houses or all sorts of things to be productive in society. But instead, I'm spending tons of my time every single day advocating for genital autonomy. How do you feel about that?
I mean, I agree. There's, I don't like the idea of, as a victim, basically allowing further, in a way, further victimization by making this issue be the forefront of essentially the rest of life, essentially. I know Brother K, I remember saying in an interview once where he didn't want this to be about his entire life. And so when his daughter was born, he didn't protest. He protested prior to that, but he never protested after she was born until many years later when she was even on her way to college. So it was like, it's a very humble thing in that sense where he was able to make his life, at least a huge portion of his adult life be what I think, kind of nature intends, which is just to have a normal life. I don't think having, in a way, having to completely hold yourself into activism as a victim, because it gives, in a way, vindication, and it's the only real way that you could heal from that pain. It kind of sucks in a way because it kind of creates further, victimization. I could be learning, woodworking or doing all sorts of interesting things, and actually I still make it a point to do those things. That's why I only, now after being involved for so long and doing the emotional healing that it took a while. I only like to spend a couple of hours a day at most with activism, because ultimately, if I allow any more than that, I feel like I'm allowing my life to be kind of directed by this singular moment that I don't want to dictate my entire life. I don't want to be just, everything that I do is because I was circumcised, right? Like that sounds like a terrible concept. I feel like it gives power to the perpetrators in ways that they don't deserve, but at the same time, what are you gonna do? Because no one else is really speaking up on this. Like I've spoken to enough passive supporters who they support the idea of genital autonomy, but at the same time they're not willing to be activists about it. They're not willing to speak out about it. They're, for various reasons, whether they think that society is going to shame them, or they're afraid of what people are going to think of them, or like this ultimate issue, which is it takes up a lot of time, it takes up a lot of energy, and your entire life could end up becoming dedicated to a cause that otherwise you might not have ever really delved into.
Yeah, and for some people it has. To me, it's pretty much becoming mine. Even when I do stuff, I used to do IT stuff for corporations, which would require a lot of thinking time, a lot of attention of my brain. So instead, what I do is I do like food deliveries, or might do Uber or Lyft rides or something like that, and those things allow my brain to continue to think about this topic while still being productive in another way. So like when I'm doing food deliveries, it doesn't really require a whole lot of brain power. I just need to be able to drive safely to get the food delivered. And when I'm doing Uber or Lyft rides, I might actually end up striking up a conversation about the topic, which my brain is still on, and I'm actually advocating for genital autonomy at the same time. But my purpose, the reason why I do it, is spend so much time, is not because I was circumcised. If I was circumcised and no one was doing it to children today, I'd probably go spend my brain energy on something more interesting and burn my synapses in my brain doing other things. But the fact that tens of thousands, and I'm serious, over 10,000 children a day in the world are getting their genitals cut. Now, I know that from what I understand, it's like 3,000 boys in the U.S. alone. But when you look at the population and you look at the areas that cut based on Islam or Judaism, and in places like South Korea and the Philippines, for slightly different reasons, it easily adds up to the tens in the 5 digits. So I think about that every single day. I wake up every day and think, man, all these children are getting their genitals cut today, and I've got to try to do something about it.
Yeah, I hear you, man. I remember those numbers used to play over in my head a lot too. I had to actively, basically, take myself out of that because it's much. It's a little much to bear, And I think what made it really worse for me was after actively coming out of the issue, a friend of mine who once told me how she was very adamant that she would never do that to her child if she ever had a child, right? A year passes and she happens to become pregnant with her partner. And, I'm like, oh, that's great. If it happens to be a boy, it won't be an issue. She won't do that to him. So I left it alone. I think I figured that everything will work out. It won't be an issue. And then, sure enough, for whatever reason, just a week before she was about to give birth, her boyfriend, who I was also friends with, he messaged me, and then we were just chatting, and then out of nowhere he brought it up, and then he was like, I don't want to talk about it or something, but he was like, but we're gonna have him circumcised, and that's the end of it. And I was just like, what? And it came out of nowhere, and I was just, and I guess it kind of in a way made everything become a whole lot more real than just that 3,000 number or 10,000, because I feel like it's very it's an awful thing when you think of these huge numbers of children every single day, and when you do online activism, you could see their faces every single day of all these different, and it's horrible. It's very daunting, and but in a way, I used to call myself stoic and activist because I try to be stoic about it and take my emotions out of the equation, and and I feel like that was the only real true way to do it. I mean, you're literally talking to all these mothers and fathers all across the country and the world who are doing this to their children, and then the way about it is like you can't, really put too much emotion in it, right? But for me, that instance with that friend of mine, her and her boyfriend, and how they just lived down the street from me, and like we were friends for years, and it was just like, why? Like, why aren't you going to talk about like why? Like, and nothing. He just was like, you're going to make such a big deal about this. How about you just lose my number?
Mm-hmm.
And I'm like I'm going to have to lose your fucking number regardless, because if you go through with this, I wouldn't want anything to do with you anyways.
Yeah.
There's this is zero tolerance. Like, there's literally no excuse for child abuse, right?
No.
And gentle cutting of these children. It's like, it's absolutely sickening. It's disturbing, and it's just like they completely, they in a way failed me, but I feel even more like I failed that child in a way, because
Yeah.
had I reached out sooner, maybe things could have been different, because maybe he was feeling that way the whole time and I didn't know it.
Yeah.
And just because she felt that way, she was kind of very passive about it. She in a way didn't care either way, and so it turned out really, really shitty, and I wish things could have turned out better. But I guess ever since then, like, it's, I don't really like to think too hard on that 3,000 number anymore, because
Yeah, I hear you.
These are real people.
It's depressing.
Yeah, that baby being mutilated, it was like, even though they're all real people, obviously, like, that was a very, very real child, mutilated essentially right before my eyes. And even though I cut them out of my life, I eventually visited another friend who I didn't know had those two people in his home at the time, and he knew it. So he came out of his house real quick before I even came to his door, and he was talking to me, and I was like, what's going on? And it's like, oh, it's because they're there. And I realized that when I started hearing the baby crying from the window, it's like, it was just like, that's so crazy,
I actually got stuck changing a diaper of a friend's baby shortly after he was mutilated, and the emotions that went up in me when I saw that just killed me. I mean, it was horrible.
Yeah.
So yeah, you just made me think I need to add friends and family to the list of relationship effects of this.
It's like, I hear people trying to just ignore it and be their friends anyways. I remember Rosemary Romberg. She talked about one of her good friends, and how she kept telling them the issue, kept telling them, and they were just like, it doesn't matter, we're gonna do it anyways. And Rosemary apparently had it in her mind where she was like, I'm just gonna step out of your life for now. In 5 years down the road, maybe we'll come back. Because she didn't want to be anywhere in that person's life while that baby literally had this fresh mortal wound.
Yeah.
And but and it's funny, because I remember reading that, and I'm just like thinking to myself, like, I couldn't possibly do that myself. I mean, that's great she could, but that is just, it's just disturbing. Like, I have a hard time sometimes with my brother, because he did that to both of his sons, well, one of his sons. But at the same time, he did it at an age, I was 13. He was 23. My brother's a lot older than me.
Mm-hmm.
I didn't any of that happened at the time. But years later, I knew that it happened. And when I brought all this stuff up, and he was like, I hear you're really upset, and you're upset with mom, and you're like yelling at her and stuff, and I was like, you just don't understand. And he actually, he in a way, he owed up to why he did what he did to his son, and where his mind was at, and he admitted to how wrong he was, right?
Nice.
And I was like, that's probably the most noble thing I guess you could do, in a way, is to be like, I was 23, and I literally did do it because of fear that he would be bullied, right? And then he explained he was a bully in the 80s. He was bullying children, or other teens, for being intact, and he was that bully. He didn't want his son to be bullied, and ultimately he became his son's first bully by doing that to him.
Yeah.
And because I was explaining to him, I'm like, you had no way to really comprehend that, at least in this area, kids don't undress anymore in the showers and locker rooms in school. You know, I hear in some parts of the country that still happens, but my experience in this area, they didn't do that. In fact, they used to have a shower, you know, for the gym or whatever. They were using it as storage, you know, because that's how much they weren't using it anymore. That's just it culturally became no longer norm in this area for them to do communal showers for the school systems. And the same for his son. You know, his son's growing up, and I ask him his perspective because he's 16 now, and he's like, yeah, like we don't undress in front of each other. So, you know, so it's like none of that would have ever even happened. And yeah,
my son actually, I chaperoned for my son's school for a pool party one time, and I was the only chaperone that the teachers trusted based on my background check to chaperone in the changing room. So I was all by myself with all these boys, and most of the boys were too shy, so they went and they tried to change inside of the stalls. So we ended up having a nice long line, and it's like, man, we need to hurry up, kids. So just change, you know, don't worry about it out in the open. My own son is over, you know, always away from the crowd of boys that were waiting in line, and he's just changing by himself, and he's intact. So, you know, but he didn't have any worries in the world, and the kids weren't picking on him or looking at him or anything, but they were picking on this one particular boy, and I don't know why. And actually, this one particular boy was not intact. So this boy, he leans up against the door and he falls out of the stall, and his pants are down and all that. And the kids start laughing at him. There was one particular kid that was kind of the leader of the group, being the bully. But I kind of found that interesting that they're picking on this kid, not my own son. So the status of the penis was nothing to do with it.
like they'll pick on kids for various reasons, but I don't think that is one of them anymore. I think maybe at some point it could have been, you know, and I think there's historical record of it, anecdotal stories from people who grew up during time periods like that. But I think ultimately nowadays it's not something that is going to be brought up as much. It's kind of like in the culture now, people will be like, it's like you can't do that because you could, you know, like what are you looking at his penis for? You're being a homo, you know, like even though we're in a very pro homosexuality culture nowadays, people I still think like that. They wouldn't, you know, they respect homosexuals, but they wouldn't want people to think that they themselves are homosexual, so they wouldn't do that. But back in the day, pulling boys' pants down and paddling them on the butt was like a form of hazing.
Yeah.
When today, I think it's looked at as very strange homoerotic type behavior in a way, you know.
Yeah.
So culture it's changed a lot, and it's bound to continue to change. We're becoming way more accepting of a lot of things. Body shaming is no longer acceptable form of you know what I mean? And it's just going to become more and more unacceptable, you know.
Yeah, I hope so.
So acceptable when it comes to making fun of males, you know, like you'll hear it in comedy and TV and stuff, and like, you know, that's sort of belittling treatment was like speaking like that about females for a long time in TV, but now it's like, now you can't say jokes like that in a TV show without someone calling attention to it and being like, oh, you're a bigot or something.
Yeah.
You know?